Hello everyone, my name is David Truong, and my topic is the effect of antibiotics on bone biopsy result. I have no disclosure. Antibiotic and bone biopsy. There is a strong belief that antibiotics should be held before a bone biopsy is performed. The reason for this is the concern of antibiotic penetrating into the bone and affecting the culture yield in the end. Some physicians actually hold this as truth and may disregard the biopsy result if the patient receives any antibiotic at all. This brings to the question of how long must the antibiotic be held for? Is it a day, 2, a week, or months? There's no general consent at all regarding to the duration. This brings us to the fact that the notion of holding antibiotic was actually derived from vertebral osteomyelitis. Vertebral osteomyelitis is very different than other osteomyelitis, such as the one resulted from diabetic foot ulcer, pressure ulcer, or trauma. And the result from vertebral OM study has often been generalized into the other type of osteomyelitis. The difference is vertebral osteomyelitis is hematogenously spread, whereas the other or direct inoculation. So the mechanism is different, the etiology is different, and to me, it should not be generalized from one to the other. Here is the most cited paper for withholding antibiotic before a biopsy. The first thing I want to point out is that this is a letter to the editor. Um, it is not original research that people are citing. They're citing a letter to the editor. And here, Dr. Hassan acknowledged that in his study or finding there is no statistical significance. And he only recommend holding antibiotic because it may improve the diagnostic view in the end. And this study is again directed toward vertebral osteomyelitis only and become the most cited paper for withholding antibiotic before culture. So the strength we see the strength on the literature to hold antibiotic is fairly low. We're going to go into that. Here is a meta-analysis published by Crisologo et al. Last year. It's the first meta-analysis looking at antibiotic and bone biopsy. They found 37 articles that deal with antibiotic exposure to biopsy. However, only 12 articles have enough data for further analysis. The first thing I'd like to point out is that in 8 of the 12 articles found negative correlation between pre-biopsy antibiotic and affecting the bacterial culture yield in the end. This is significant. This tells us that that notion of holding antibiotic is not true. However, something that we need to take into consideration is the other factor we have. First, most of the study are in vertebral osteomyelitis, which is where the majority of the data are from. There's only one in diabetic foot ulcer. Second, the reference standard for diagnosing osteomyelitis is all over the place. Here you see it could be from clinical history, radiograph, MRI, CT. There's one that uses bone biopsy. So there's no general consent on what is the reference standard for diagnosing osteomyelitis. However, we know the gold standard is a bone biopsy, which only one of the study employed. Because of the poor reference standard, the bias risk for the studies are fairly high overall. And the number of subjects are fairly low in majority of the studies, which will definitely affect the power analysis. Here we have one study that dedicated to diabetic foot ulcer, and it is the only prospective study in this group. As you can see, they have also the most number of subjects, and in itself found no correlation between pre-biopsy antibiotic and bacterial yield in the end. However, the question here is, how long did those patients receive antibiotic for? Was it a couple days, weeks, months? There's no specification in the majority of the study the duration of antibiotic they received. If there were, then they usually just clump them into one group as a pre-biopsy antibiotic group. That's really, to me, bring up the question of, does the duration of antibiotic given to the patient prior to the bone biopsy affect the result in the end? To address that, Lavre et al. Actually looked into that exact question. He did a retrospective study of 142 patients, and the reference standard that he used is the gold standard, which is the histopathology of the bone culture, and bone biopsy. what he found is that in there's no difference in positive bone culture for osteomyelitis in patients who receive antibiotic and in those who did not receive antibiotic. The percentage actually did decrease a little bit between in those who did receive antibiotic, but statistically speaking, there's no difference. The same is hold true for the number of bacterial culture yield. Here, what I like about this paper by Lavery is that he actually broke it down into three groups. Group number one is those who did not receive any antibiotic. Group number two, those who receive it for 1 to 3 days. And the last group is those who receive it for 4 or more days, the long-term group. And here we do see that the more days antibiotic the patient received, there is a decrease in the number of bacterial culture yield, but it is minimal. And when you look at the p-value, again, it is not statistically significant. Thus, they concluded there's no difference in patients who received or did not receive antibiotic prior to a bone biopsy. So in conclusion, the notion that antibiotics should be held prior to bone biopsy was extrapolated from vertebral osteomyelitis and doesn't necessarily apply to other type of osteomyelitis. And what we talked about is just the etiology is different and the presentation is different, and it does not correlate well, and we need well. So personally, I recommend starting antibiotic on patient who present with local or systemic sign of infection, as there should be little to no fear affecting the bone culture, as shown by Lavery and in the meta-analysis. A lot of my the patient I treated has a diabetic patient who are immunosuppressed. So the sooner we get the antibiotic, administered to them, the better the chance of them saving that foot and that limb. I personally do not have the patient antibiotic be held prior to a bone biopsy, because I believe that it takes more than a day or a dose antibiotic to really penetrate to the bone and cause that drastic of a difference in the culture yield. And Lavery's study did show that data to be true. As always, there's more research always needed in other type of osteomyelitis before we can make a more strong recommendation. Thank you for your time. If you have any questions, please feel free to contact me.